picked it out today.
Molly Sapega left a job she loved for the best job in the world, motherhood. But leaving the workforce behind meant leaving her benefits behind.
You know, with a child, you cannot have health care. We have to have health care.
For their family of 3, it cost the Sapegas $645 a month.
It went up every year. Our deductibles went up every year. Our premiums would go up $200, $300 a year.
And she says nothing on the healthcare.gov marketplace was affordable until now.
With this new subsidies, I mean, we could save $400 or $500 a month.
With newly expanded subsidies, the Sapegas, a squarely middle-class family, found dozens of options that weren't there last year. A plan costing nothing each month with a high deductible, another with no deductible and a high monthly premium. And now she can get something similar to her current plan for just $225 a month.
You know, it's almost hard to believe because we never imagined that we would get subsidies like this. Obviously.
What's really funny is there are a lot of people who think it's too good to be true. They want to know what's the catch.
The catch is it could all be temporary if Congress doesn't extend the subsidies beyond next year. But for now, independent insurance agent Margot Cast says she's found savings for families making up to $200,000 and $300,000 a year.
A 62 and a 63-year-old husband and wife, before, if they were making more than $68,000, they just weren't getting any help. And some of them were paying, close to $2,000 in premium a month.
Now she says she can find that same couple a plan with no monthly premium.
It actually creates an incentive to continue earning money.
But it comes with a huge price tag to the American taxpayer. The Congressional Budget Office estimates the expansion of the health care subsidies will increase the national debt by $34 billion over the next 10 years. Expanded subsidies are going to tack on billions of dollars to the deficit. How are we going to pay for it?
Well, I think you'll find that making sure that people have access to quality, affordable health care in the end ends up saving money.
Assistant Secretary for the Department of Health and Human Services, Dr. Rachel Levine, said she'd need to defer to President Joe Biden on how this is all going to be funded. But she did say the number of people taking advantage of the expansion is evidence it's money well spent.
I think it has been really a tremendous outpouring with 1 million more people who've signed up, in addition to the 2 million people who went back and got lower premiums.
We're going to do it. Of course, anything with Congress, you're a little skeptical. Is it going to stay? Is it going to change when Congress changes?
For Sapega, if the cost of care continues to rise, she'll have to make a decision she's avoided for 5 years.
You know, something that I cherish, staying home with my child, or am I going to go back to work just to get health care?